right, I think we are live. Hi there, come join us. My name's Christine Burak. I'm a health and science reporter with CBC National News, and today we are taking your questions on birth control. Yesterday, I did a story for The National, and welcome on YouTube as well. It was from the Canadian Paediatric Society. They first line of defense against pregnancy in teen girls, they feel that doctors should recommend IUDs, intrauterine devices. And there's also intrauterine systems. We'll get into what they mean. But we want your questions. There was a lot of comments underneath the story posted on our Facebook page, so we wanted to answer some of your questions. So to answer some of those questions, I have with me Dr. Rachel Spitzer. Dr. Spitzer is a pediatric and adolescent gynecologist here at the Hospital for Sick Children in Toronto, and she is taking time out to answer your questions. So like I said, go down into the comments. Ask your questions about IUDs. For the most part, we're talking about younger people, teenagers and sex, but the reality is it happens. And the Canadian Paediatric Society, from their statement, they were, in a lot of ways, they were just saying that we're putting out options. What did you take from their position?
Absolutely. Well, I mean, I think their position, first of all, just brings their society in line with the recommendations, not only that are borne out by scientific papers and scientific research over the past years, also brings them in line with recommendations of other societies, such as the Society of Obstetricians and Gynecologists of Canada, which has been recommending that IUDs can be considered first-line contraception for adolescents for many years, the American College of Obstetricians and Gynecologists, etc. So they're just bringing themselves in line. And really this was a position statement not only on IUDs, but on contraception for adolescents. And they went through various different contraceptives and looked at the effectiveness in perfect use and in what we call more typical use. So for example, if you take a birth control pill perfectly, you get one outcome. The average person sometimes forgets to take a pill every now and then, things like that. So we have, sort of a separate category, typical use. And then they graded them. They graded the different kinds of contraception based on their effectiveness and classed them. And what they were pointing out for the first time by the Paediatric Society in Canada was that class 1, or the tier 1 rather, the most effective forms of contraception for adolescents were IUDs and also transdermal implants, although caught people's attention.
I think also what caught people's attention was this bit of, I think people saw it as move over birth. And you're comfortable, that's fine. But in a perfect world, and you're taking it every day at the And do you think that's going to change?
I mean, I think it might on some level, I suppose. I hope it does. I think it just opens up people's mind. I think that what we're talking about and what the recommendations, right? And the conversation is always there between the woman or the adolescent and her healthcare provider about her circumstances, what her other health issues are, which may make some forms of birth control not an option for her, depending on sort of medical conditions. And the position paper actually also commented very specifically about taking a good medical history and some of the contraindications or reasons that people can't safely take the birth control pill, which sometimes healthcare providers will not delve into deeply enough. And so there were reminders about those questions that we should be asking. So I think it just brings it back to the interaction between the individual and their healthcare provider, and that this is put out there really just to identify to our healthcare providers, in this case Canadian Paediatric Society, pediatricians in particular, that these should be considered first line and not forgotten about as part of that conversation, or not considered not appropriate for discussion with adolescents, but rather should be very much there as a part of the discussion and identified for how effective they are and known to be safe in that age group.
Okay, we have questions rolling in. If you're just joining us or you're scrolling by, stop. We're taking your questions on birth control. A lot of questions about IUDs because of the position paper that came out from the Canadian Paediatric Society. Dr. Spitzer is here to answer your questions, so put them in the comments and we'll try to get them answered. All right, our first question is from Melissa Ball, and she's asking, what about STD protection? feel it will be a false, safe, a sense of security, which is a great question that has come up about birth control in general.
For sure. So thank you, Melissa. I think that's a really important point, and that was actually in the position paper as well, and a really important point to make. The bottom line is that condoms are the only protection against sexually transmitted infections, and we should not lose that messaging at all, and we should be encouraging, frankly, potentially anybody who's sexually active, our adolescents in particular, to be using condoms in addition to whatever form of contraception they may be using as well. I think we've known for a long time, though, that condoms are not the most effective or the best form of contraception or prevention of pregnancy. And so again, and actually the comment about condoms and STI protection was in there, but again, what this statement that's led to our conversation today is saying is that the most effective forms of contraception include IUDs, and frankly, birth control pills are also much more effective than condoms as contraception, but we should absolutely always be encouraging the use of condoms for protection against sexually transmitted infections.
Not losing sight of that. Great question. Thanks for that, Melissa. Okay, we have another question from Terry Brewer is asking, I've heard that IUDs can also help moderate heavy periods. Is that true?
Sure. Well, so there are two basic different forms of intrauterine devices that are on the market. What are sort of classically called IUDs or intrauterine devices usually have a little bit of copper on them, no hormones, and actually will typically make periods a little bit heavier or crampier for those people who are using them. What are called IUS or intrauterine systems there are 3 different kinds on the market, and they all have slightly different amounts, but of progesterone hormone on the IUD. When it's put in, that's usually followed by some time of nuisance bleeding, usually lighter bleeding, but unpredictable bleeding that can last up to a number of months. And then by 6 months, again, depending on the specific system or amount of progesterone that's on it, most women will have much, much less bleeding than they would have without the IUD, up to the potential for no bleeding at all for as long as the device remains in place. And that's actually an important reason that these intrauterine systems are on the market as well for all age groups and populations, and they can be very helpful tools in managing people's menstrual concerns as well.
All right, Terry, I hope that answers your question. Thank you so much for it. All right, this is a question that I think we're going to get in various forms. So Cheryl Barrage is asking, have there been improvements? And this is a huge question because IUDs go back decades to the 1960s, and one IUD in particular that brought on a flood of lawsuits. People talked about infections, they talked about ectopic pregnancies, they even said that it caused death. So I think the conversation in North America has been shaped around our IUDs largely because of this one IUD. So where are we at now?
Yeah. So what you're referring to was a device called the Dalcon Shield that was around in the 1970s. It's a long medical story, but the bottom line was it had a different sort of thread on it that actually hadn't properly gone through trials, et cetera, caused problems and was removed from the market. We've had copper IUDs on the market for a long time still. They are more modernized, they're very safe and effective. And the hormonal intrauterine systems have been around for between 10 and 15 years now and have really been very well received and very well tolerated. The IUDs of today are not the IUDs of yesteryear. Every IUD, every medication, every medical device does have some small risks that are associated with it, and those should be discussed and acknowledged and consented with each woman at the time that she's making the choice to get an intrauterine device or intrauterine system. But you know, if you're thinking about contraceptives and if you're choosing between contraceptives, there are going to be small risks and benefits to each. And again, those are to be compared and decided on by the individual. I think the question of ectopic pregnancy is an interesting one. Any IUD sits in the uterus, and so the whole point is to prevent pregnancy in the uterus. Everything out there fails to some small extent. What we're saying is IUDs fail less than other forms of contraception, but every now and then somebody can have a pregnancy with an IUD. And because the IUD is in the uterus, there is a higher proportional chance of a pregnancy going. Pregnancy rate is still going to be far, far, far lower. And again, it actually is part of the counseling on IUDs that if that very rare event of pregnancy took place, that there is a higher proportional chance that pregnancy could be in the tube and not in the uterus. an appropriate pull test should be done to identify that.
All right, great question. For anybody who might be just joining this CBC News Facebook Live, we're talking about birth control, we're talking about IUDs and young people. We're taking questions. Put it down in the comments section. We'll try to get it answered by Dr. Spitzer. Okay, next question is from Sam Puchala. I'm sorry if I get your names wrong. I will do my best. Can non-hormonal IUDs contribute to seemingly hormonal issues such as hair loss, weight gain, increased anxiety? This is a common complaint. Is this a common complaint even with copper IUDs?
So it shouldn't be a complaint with copper IUDs at all. Copper IUDs have no hormones. When you have a copper IUD in your body is cycling, producing hormones, etc., just the same as it would be if the IUD weren't there. When we do see people have symptoms, the question is sometimes, what were they using before the IUD? There may be some people who maybe were on the birth control pill and switched to a copper IUD, and maybe the pill was actually helping to regulate some aspects of their cycles. Maybe they went on the pill because they had acne, and then when they stop the pill and put in the IUD, the acne comes back because it's not making those hormonal changes for them. So the copper IUD has absolutely no impact on hormones whatsoever. Again, I guess sometimes it may depend what the individual is switching from, and some of the things that they may have forgotten about experiencing with their own cycling of the hormones from before they were taking another form of contraception may come back for them. Maybe
All right.
That has something to do with it.
Okay, I think a lot of the questions that we're going to get are around risks, so we'll get into a series, and I think you've been slowly giving us a sense of the risks, and there are risks involved with everything. I think we've heard in this case there's small. We should probably talk about the insertion, because I think a lot of the questions are around the insertion and the cramping. So first off, let's start with who can do it.
So the insertion can be done by any trained health professional. So long as they've gone through some training in this. It could be a physician. That physician could be a generalist physician, a specialist physician, like a pediatrician or a gynecologist. That could be a nurse or nurse practitioner. So any of those kinds of individuals who've had the training to do it and are comfortable with pelvic exams.
So what, and if you haven't seen what an IUD looks like, we did a story last night, and maybe you can click on it, but it's just like a tiny T almost, and the copper one has copper wrapped around it, and the hormonal one has a little red patch on it. So in this,
they're actually white.
Oh, is it? Oh, is it? I saw the picture.
That was the demo one with the red that was on here.
Okay.
I saw that too.
So basically it's inserted and then it sits in the uterus. It's like a T, like it has little arms that come down, and it's removable. So here are some of the questions that I'm seeing now from people about the risks. So Melinda Ahmed is asking, so what happens when one implants to the uterine wall?
So the bottom line is they shouldn't actually implant into the uterine wall. Occasionally, as a gynecologist, I get some reports, ultrasound reports about the orientation between the IUD and the uterine wall. If it's a little bit inappropriate, sometimes we can remove and put a new one in to reposition, but I've never actually seen one that's been implanted into the uterine wall. If it was slightly indenting the wall or abutting the wall, if it were removed, everything would just go back to normal. Don't forget, the lining of the uterus is sort of constantly regenerating as tissue, and would heal very, very easily from any small indentation or anything like that.
Okay, I hope that answers your question, Melinda.
And I was just for people out there as well, I think one other point to make is the contraception literature, the scientific literature, is actually quite clear that we don't need to regularly be doing ultrasounds on women with IUDs just to look for the location of them if those women aren't having symptoms or complaints. I actually don't do ultrasounds routinely on any of my patients with IUDs. I insert an IUD, which we can talk about more. Then the person comes back to me the next month, and I actually just do an internal exam to look for the little strings that are coming from the IUD to know that the IUD is where it should be in the uterus, and that's it. If on ultrasound the position of the IUD is slightly imperfect, it actually doesn't change its contraceptive effectiveness, and if somebody's not having symptoms or discomfort from it, it's actually not a problem.
All right, this is another question that I see being cycled through a lot, and it has to do with hormones. And I find it interesting because birth control pills are also hormones, but here's the question from Jen Eastwood Fisher. What is the likelihood of an IUD causing long-term hormonal problems, weight gain in not yet mature females? So is this setting them up for problems down the road somehow?
So, I mean, I think we have to first of all go back to the part of the question about not yet mature. While for sure our adolescents are still growing, their bodies are undergoing some changes still. By the time a young woman gets her period, her uterus has a mature shape and size. It's not actually different than that of somebody, many years older if they haven't had a child yet. Sometimes it changes size a little bit after you've had a baby, forevermore. But for the most part, if you're having your period, your uterus is physically mature, and your body has actually undergone most of its growing and maturing by the time the period starts. And you're cycling hormonally, again, just the same way as somebody who's quite a number of years older. So while I know for parents, for some adolescents themselves, thinking of treating our adolescent girls with these very adult kinds of medications like IUDs and birth control pills may come as a bit of a, sort of shock initially, it really is quite the same for them as for their older counterparts.
Oh, that is good to know. Okay, this is an email that I appreciate because I've seen a lot of messages like this below the Facebook story. It comes from Loretta Mack. IUDs, this is Loretta's message. IUDs are dangerous technology. Almost died with one back in the 70s. Why do things that don't work keep getting rehashed by people who should know better if they bother to do their homework? So clearly, Loretta, sorry that you had a bad experience in the 70s, but bring us into 2018.
Yeah. So I'm sorry as well for Loretta's experience. I think that the IUDs that were available in the 70s were very different than what we have now. As I mentioned earlier in the broadcast, there was one in particular in that era that did have infection consequences that were quite dire for many women. The IUDs now are very thoroughly tested. And we make our patients aware of the small risks of IUD insertion. But what I usually quote to my patients is that within the 21 days after the insertion of either an intrauterine device or intrauterine system, that there is an increased risk of pelvic infections. And for that reason, I ask them intercourse, or if they are going to have intercourse, to use a condom during that time, 100% of the time, to limit the potential for that risk. With the current IUDs, or expulsion. That's not a harmful risk, it's just the risk that within the weeks, particularly after insertion, or I suppose technically at any time, but it's more common sooner than later, that the uterus could actually okay? So those women need to know that that's a potential. I would tell women, if you see it in your underwear or you see it in the toilet, it's not impossible. And obviously they need to know then that they're not protected, and we need to know so we can discuss if we're going to put another one in or use a different method. There's also a less than 1% chance of what's called perforation, and that's that at the time the IUD is placed, that it goes, instead of sitting inside the uterus, through the wall of the uterus and into the abdomen. That's why all patients should come back for a strings check or have some mechanism to make sure that the IUD is in the proper location. But that is a less than 1% chance. Unlike our writer's experience, it's not usually a life-threatening circumstance, but would absolutely need to be dealt with a procedure to remove the IUD. And again, the woman just needs to know that she's not protected when she might otherwise think that she is.
All right, Loretta, thank you so much for your comment. I'm glad you got into the insertion, because the next question is sort of related. It's from Joey Brassard Desjardins. Will you explain how painful it is to get it inserted? So you explain the process, but
Sure.
How do you tell patients how much is this going to hurt?
Sure. Well, it does take place during a vaginal exam. I usually say to patients, allows the health practitioner who's doing it to visualize or see the cervix, the top of the vagina. We then usually put a little holder on the cervix. We put a little device inside that usually just measures the length of the uterus and allows you to set up the insertion wand that comes with the IUD or the IUS to be appropriately measured for that individual. And then the wand slides in. There's a little mechanism on it to help us insert it properly, and it all comes out. And it doesn't actually take that much longer than I've spent talking about it. And I should say that we cleanse the cervix or use a little bit of sterilizing solution on the cervix before we do that. So it really takes about 5 minutes to do. It is in our guidelines usually also to precede the insertion with swabs for infection so that we ensure that somebody doesn't have an active infection on the day of insertion as well. So a couple of swabs done beforehand. But it takes about 5 minutes to do. Now in terms of pain, I would say that that's a very individual question. Some people know that they tolerate pain well, some people know that they don't. You take your kids for their injections, you know that some of them, take it with a smile and some of them scream a lot. We all know ourselves and our experiences of pain a little bit. If somebody knows that they're going for an insertion, for sure I would recommend they could take a Tylenol or Advil before they go to help themselves a little bit. Some people walk right out the door and go to work. Some people need the rest of the afternoon off and are fine the next day. I would say to experience a little bit of cramps similar to menstrual cramps immediately after the insertion and for some hours, maybe even at the most a couple of days afterwards would be typical. Anything much more severe than that would be unusual.
All right. Okay, I hope that answers your question. Our next question comes from Terry Stewart McVeigh. It's a comment and a bit of a question. I find birth control is prescribed so freely without a doctor going over or speaking of any risks at all when there definitely are some risks. Because these are teens usually asking, I feel more details need to be given. Do you feel they're given enough? And does the IUD cause less side effects? I'm guessing less side effects maybe than the pill.
Yeah, again, it depends. First of all, I do agree that anybody prescribing any medication should go over the benefits and the small risks and the most concerning risks with those individuals. I will say that when it comes to birth control, there are some moves afoot to have it available over the counter. The risks are small, and obviously nobody's standing there talking to you about them. So I will say that at least that perspective exists. We're not there yet in Canada, that's for sure. In terms of the IUD, I've briefly described some of the small risks related to the insertion. With the intrauterine systems, with the progesterone hormone on them, they do typically cause, as I've mentioned before, some nuisance bleeding, and that'll sort of settle into place over the first number of months that the intrauterine system is in place, so women will experience that. Beyond that, there are few other common side effects that women will experience, although of course there are people out there who've experienced, small numbers of many different side effects. I would say in general, because you're not ingesting a pill, you're not putting a medication into your whole body, that there are less side effects. Also on the intrauterine systems, there's only the one hormone, progesterone. Birth control pills are most typically a combination of both estrogen and progesterone, and so those two hormones will often lead to different kinds of side effects and perhaps more side effects in some users.
All right. Okay, if you're just joining us, welcome to the CBC News Facebook Live. We're talking about We have Dr. Spitzer here taking your questions. Most of them are about IUDs and the Canadian Paediatric Society saying they support the use of IUDs as a first line of defense against pregnancy in teenage girls. Lots of great questions so far, so keep them coming. If you want to put your question in the comments, we'll try to get it answered. All right, the next one is from Carolyn Jarrett Bagu. Does it cause spontaneous abortions? So I take it, does an IUD
I guess it depends at what timing. So if you already have IUD in place, and if you are one of the very, very rare women to experience a pregnancy with an IUD in place, there is indeed a higher rate of miscarriage and complications with that IUD. And actually, if somebody were wishing to continue the pregnancy, if we can, it's the recommendation to remove the IUD, which also carries a small risk of miscarriage, but a smaller risk than leaving it in place, okay? Sometimes we can't see the strings and can't remove it. But if the question is about, once that IUD is removed, no, not at all. Once any sort of intrauterine device or intrauterine system is removed, any side effects or any effects of the IUD are actually resolved within 24 hours. Fertility returns to normal within 24 hours, so they're incredibly effective, but they're also incredibly quick to reverse their effects, and people's cycles just go back to normal for what that person experiences. So that's...
one of the questions that I heard after I had done this story was young women who had asked about IUDs, their doctor would often ask, you haven't had children yet, so this isn't a good idea for you.
Right, so that's a myth, and I think that that's to some extent what the opportunity to talk about this position statement with. There is no need to have had a baby before getting an IUD. There is no need to have had a pregnancy before getting an IUD. There are actually, well, first of all, we put intrauterine devices and intrauterine systems regularly in women and adolescents of all ages. I don't think that there's a problem with the size of most of the devices, but if women are concerned, both copper intrauterine devices and the intrauterine systems come in a couple of size variations. So if people are concerned that they might feel it, or they're concerned that their uterus is small because they're young, there are actually slightly smaller sizes that are available that the manufacturers have made available for us because of that. But you don't have to be a certain age, you don't have to have had any pregnancies.
All right, thanks for your question, Carolyn. Okay, the next question comes from Claire Lorden. What about the birth control implant? So I guess this is the transdermal patches, and that can be inserted in the arm. Well, I think we heard Dr. Spitzer mention they're not available in Canada as of yet, but what do you think is on the horizon?
Sure. So just to be clear, transdermal patches, which is a birth control patch with a combination of estrogen and progesterone like the pill, you change the patch once a week.
Oh, okay.
That is available in Canada. Okay, we do have that, but it's analogous to the pill. It's just a different way of taking that combination of estrogen and progesterone rather than swallowing a pill every day, a patch on the skin. What we don't have in Canada are the transdermal implants. So they go just, sort of in the soft tissue of the arm. It used to be many rods. It's now just one rod. They're available in the United States. They're available all over Europe. They're available in the Southern Hemisphere, in most countries as well. Nobody's put the application through to Health Canada.
That's my understanding.
Yeah, and so, every now and then I hear a buzz from companies and things like that, but to my knowledge, it's not here and it's not anywhere on the immediate horizon. I wish we had it, but it's not in my power to change that.
All right, I hope that answers your question. Okay, so I'm getting a message.
To clarify, it's just progesterone, kind of like what's in the IUD, and can stay usually for 3 years.
And so that's 3 years. And I guess we didn't really get into the copper IUD is 3 to 5 years?
The copper IUD is 3 to 10 years.
3 to 10 years, preventing pregnancy for 3 to 10 years.
That's right. Most IUDs are 5 years, but there are versions of both copper IUDs and hormonal intrauterine systems that are 3 years. And the copper, specifically the IUD, has a 10-year version. The hormonal one does not have a 10-year version.
Okay.
But if people are liking them, they can be removed at the end of their lifespan and a new one inserted at the same visit. And as I said previously, either kind can be removed at any time with the effects reversing within 24 hours.
Okay. All right. Several questions about pelvic infections. I know we've talked about this, but clearly it is important to understand, and I think a lot of people are still worried about the infections. I'm going to roll that in. So talk to us about pelvic infections and FZ Benmokadem. Sorry about that. I don't know. I'm really ruining that name. But is it a fact or a myth that IUDs cause back pain and anxiety? So infections, back pain, anxiety. Where are we at?
So I'll go with the back pain and the anxiety first. I don't really see a mechanism by which they could cause those. And so I would say that to me that should be a myth. Although if women are having ongoing pain and pelvic pain or back pain after insertion of an IUD or IUS, they should be seeing their doctor and following up about that. The progesterone hormones have some, the progesterone IUDs, there is some uptake of progesterone in the body. Some people may find that affects their mood, but I would say that that's in general fairly rare, or in general should settle out after a brief period that the device has been in. In terms of pelvic infections, as I believe we talked about before, we do know that there is an increased risk of pelvic infections in women who have IUDs for 21 days after insertion. And so we do caution women who are getting IUDs or IUSs about that risk, encouraging them not to have intercourse, or if they do have intercourse, to use a condom 100% of the time during that time frame for protection from infections. After 21 days, no difference between users of IUDs or IUSs and people who don't. And in fact, IUDs, again, are considered first-line options for women who are immune compromised, for example, people with HIV, people who have organ transplants, etc., are considered to be able to use IUDs very, very safely and regularly do. And as I mentioned at the time of insertion, usually we check to make sure that there aren't any infections already present. We wouldn't want to insert a device in the presence of an infection. Although again, our guidelines state if we do those swabs, put it in, and nobody's having any symptoms, do the swabs, put in the IUD, and the swab comes back positive, we can actually treat the infection without removing the IUD. For those women who get an infection while they already have an IUD in place, same thing. We can treat the infection without removing the IUD, so long as the symptoms improve. Otherwise, we have to remove it.
All right, lots of great questions coming in. If you have a question, we've still got some time left. Put it into the comments. We'll try to get it answered by Dr. Spitzer here. This question, we did answer it, but I'll just mention Lena Neru-Scheimert. Our doctor recommends IUD only after birth of children. Do you agree? The answer was?
I disagree.
Disagree.
It can be first line whether you've had a kid or not.
All right, Terry Stewart McVeigh. Is this something teens should use? I thought there was a risk of infertility.
So there is no known risk of infertility as a result of intrauterine devices or systems. You know, again, I think that the point of the position statement is not about the should use. The point is that it's safe and it absolutely can be considered first line up there with any other option and should be a discussion between the adult woman or the adolescent and her healthcare practitioner.
And I think they're really underlining options, giving options, effective options.
Absolutely.
All right, Crystal, who is watching on YouTube, wants to know, from my own experience, this device is not fully safe for all that use it. In the 5 years I had the device, it caused me so many issues, which ended in the IUD stabbing my uterus.
So again, that probably relates to a finding on ultrasound where the arm of the IUD was pushing into the uterus. I'm sorry that Crystal had that experience. I would only say that when it's removed, that the lining of the uterus can long-term problems. Most women tolerate them very well. If we look at the scientific papers, look at hundreds of thousands of users and who then, you know, sort of fill out questionnaires and give us information back that leads to our scientific papers and our recommendation, most people tolerate IUDs and IUSs very well.
All right, thanks for your comment, Crystal. Okay, so we're also seeing several comments from women who say they became pregnant with an IUD. How does that happen?
Well, there is nothing in life that is 100%, okay? So again, what this position paper is identifying is that, you know, an IUD is placed, you can't forget to take it every day, etc. So the typical use and the perfect use are essentially exactly the same. Once it's there, it's there. But if you look through the details of the paper and you look through the details of any study, you'll see that there is absolutely no contraception that is 100%. Ish range, IUDs. Birth control pills are generally in the 95 to 99% category if used perfectly, less than that if pills are forgotten and such, but nothing is 100%. And so occasionally somebody will get pregnant with an IUD in place. I did mention before there's management issues in terms of what you do with the IUD depending on whether the individual chooses to continue with the pregnancy or not. And those are also things that should be discussed at the time that the contraceptions are being discussed and provided. And even surgical contraception is not 100%.
Okay. The next question comes from Alexandra Borg. Please compare, and I think this is a question that a lot of people might be asking, please compare the negative side effects of IUDs and IUDs.
So when I talk to patients about IUDs and IUSs, I talk mostly about bleeding side effects because those are the most common ones. The IUD with the copper on it, which has no hormones, typically the sides really are only related to bleeding, and they do tend to make periods heavier and crampier. The IUSs with the progesterone hormone on them do tend to lead to spotting, usually lower volumes of bleeding than women would be getting with their regular period. It can be months of annoying and unpredictable spotting and things. Usually by up to 6 months after the device, they get into a pattern that's more typical, either with periods that are much lighter than usual or sometimes completely periods do also typically get lighter, less crampy. Those are the good kinds of side effects. People notice usually that they have less acne. People who suffer regularly from ovarian cysts usually get less cysts. The negative side effects can include things like nausea, breast tenderness, can include mood and appetite changes. Most of those are mild, and most of those will resolve within the first 2 to 3 months of taking the pill. Includes headaches as well. The one thing that we talk to women about on the birth control pill, and this pertains to the estrogen component of the pill, doesn't apply at all to IUDs of any kind, is blood clots. There is a very small increased risk of blood clots, potentially in the leg or the lungs. that women
with birth control
with
pills.
birth control pills that contain estrogen specifically. The increased risk is very small, and we do talk to women about that when we prescribe, talk about what the symptoms could be: painful, sore, swollen leg, sharp, sudden chest pain, and would encourage them to present to the emergency department if they have those symptoms. Okay, it's about 2 to 3 per 10,000 per year in addition to the baseline risk.
All right, Alexandra, I hope that answers your question. I think that does cover it. I didn't know about the clots and the birth control pills. All right, Colleen Tough Wyatt. I have never heard this, so this is interesting. Please comment on the frequent complaint that male partners have regarding discomfort for them during intercourse.
So, as I mentioned, when we insert the IUDs, there are little strings that hang out through the cervix, and we trim those, and when we do an examination on a woman who has an IUD or an IUS, we can see those little strings sticking out from the cervix. Male partners do occasionally, I don't find often, but occasionally will comment that they can feel those, or that they're pokey or uncomfortable during intercourse. I do actually tell my patients that, and I always invite them to return. We can trim the strings a little bit shorter if they're bothersome to their partner, although we need to be able to see some of the string because that's how we remove them when it's time to remove the device as well. I find that for the most part, most people, both the woman who has the IUD and any partners, don't feel the IUD and don't complain about it. They don't feel the strings and don't complain about it too much, but if they do, we can help it.
All right, great question, Colleen. Okay, next question comes from Cassandra Marie. Are the risks of cancer higher with IUDs?
There's, to my knowledge, no concern about increased risks of cancers with IUDs.
All right, Sherry Pylon Caldwell. Isn't the pill less expensive for the patient and healthcare system? That is a great question.
That is a great question. So, first of all, I know that people are watching all over, but some jurisdictions, and we're talking from Ontario, and this is a new thing for us this calendar year, that our province offers free medications for those under the age of 25. So, the one particular intrauterine system of the 3 that are available is covered under that program.
And the average cost is around $300?
Yeah, so for the intrauterine systems with progesterone, the cost is between about $300 and about $450. The one that's covered on the plan that's available to those under 25 is one of the more expensive versions. It's sort of the original one, and the other 2 are more recent to market and aren't yet on that plan. Also, drug insurance plans would pay for them. So if you don't have a provincial plan that covers you, but you have a private insurance plan, because it's got hormone and medication on it, it's considered like any prescription. The physician gives it to you, you take it to the pharmacy. If you have an insurance provider that covers the cost, it would do it right there at the pharmacy for you, and you'd only have to pay the copay that you have to pay at the pharmacy or what have you. The IUDs with copper on them are a little bit different. They aren't for us in Ontario on our provincial plan, but the cost is typically much cheaper. They're usually between $60 and $100 depending on the brand, and again can last for 3 to 10 years. And because they don't have a medication on them, sometimes private insurance providers don't cover the cost of them because they're a device and not a medication, although again, depending on the individual's plan, they may be covered. To go to the question of compared to birth control pills, again, many people, whether through a local government plan or through private insurance, would have coverage for birth control pills. If you have to pay out of pocket, depending on the exact brand, between $20 and $30 a month. If you're using a patch or a vaginal ring, they can be up to $40 to $60 per month. So if you do the math on it, if the individual is paying out, the one-time paying out of even up to $450 is going to come out less than $20 to even $60 per month times 5 years. Yeah. But a lot of people would have coverage opportunities for that. Just to mention, for those who are paying out of pocket and in areas where they have access to certain sexual health clinics, there are many sexual health clinics that may help with the cost or provide medications at cost, which would be much cheaper and eliminate the profit that the drug companies and pharmacies see.
All right, yeah, and it's important to remember those terms of the IUD is used, or IUS is used over a number of years. The birth control pill is month to month. All right, I think we're going to be winding down soon, but we've got some great questions coming in. Dr. Spitzer is a pediatric and adolescent gynecologist at the Hospital for Sick Children here in Toronto. If you have questions about birth control, we're talking about teenagers. In a lot of cases, we're talking about young women. In general, birth control questions, you can put them into the comments. All right, YouTube viewer asking if there there's something inside the plastic. I think people have issues with putting plastic. I think people have issues with putting anything in their body. But what do you make of the plastic?
So they're made out of silicone and have been very well tested for long-term use. I've never seen one not come out completely intact or with any sort of problems. And these really are medical grade devices. Okay, so it's not, it's very carefully made. And what's on the arm of the device is really an insert that has a slow release mechanism for the progesterone that's in there.
Okay, next question is from Penny Wright-Linton. Why is it being used for a treatment for thickening of the uteral wall when thyroid medication is being used? Adding IUD would create hormonal imbalance, so someone on thyroid meds should stay far away from IUDs.
No impact, and the two don't counteract or interact rather with one another in any way, and so that wouldn't be a problem. The first part of the question, there are certain medical conditions where intrauterine systems with progesterone on them could be used to manage uterine lining problems or bleeding problems. I think I mentioned that earlier in the broadcast. Because they do, the progesterone thins the lining of the uterus. That's what leads over time to less bleeding or absent bleeding. And for certain women and certain medical conditions, they are actually a great tool for us to use. Those are usually outside of the adolescent. Great uses beyond just contraception.
All right, I hope that answers your question, Peggy. Next question is from Rick. Rick, we have a guy putting in a question. This is great. Rick Biddle. When the doctor says that most people use an IUD trouble-free, can she also give a percentage of people that do experience problems, short-term or long-term? Great question.
Thank you. Well, I mean, when we talk, most women will experience those changes in their bleeding over the first month. So the nuisance bleeding, the spotting, etc., that's an overwhelming number of patients, but we counsel appropriately beforehand and tell them to expect it. In terms of the long-term complications, I'd have to go look at studies, but it's certainly a very small proportion of people who have those long-term.
So can you give a rough percentage of, would it be
5%?
5% might have problems and 95% have generally a good experience. All right, Rick, thanks for your question. I hope that answers it. Oh, we have another guy. Wow, we're starting to get into a new audience now. Andy Allen. Easiest to use for men, perhaps. They don't have to use them inserted or put up with any discomfort and pain when they don't work effectively. They don't protect against STDs. Can fall out, need to be removed by a clinician. That's an important point. They do need to be inserted and removed by a clinician. When not wanted, why put any foreign body internally if it's not absolutely necessary? I think this is a fear that a lot of people have.
And I mean, there's the ick factor, right? Like a lot of people don't like it, and that's okay. I think, again, the point of the position statement, the point of all of these conversations is that they are safe, they are effective for women in all age groups, most especially in
as Dr. Spitzer has said, birth control will not protect you from gonorrhea or chlamydia, so the condoms are still important. All right, we are wrapping up a couple more questions. This one comes from Christina Strong. What is it like when removing an IUD? Does it hurt? How does the person feel afterwards? That's a good question.
So removal of IUD is actually much simpler than the insertion. Again, usually we use a speculum so that we can visualize or see the strings that are coming through the cervix, and literally it's just sort of a momentary cramp as it's removed when it's pulled out by those strings. It's faster than the insertion. Most patients, when I do, oh, that's it, and people should feel perfectly fine afterwards. No symptoms at all usually, sometimes maybe a little bit of spotting or such. but that would be about it. Very, very occasionally, when you go back to remove it, the strings are difficult to see. So occasionally people do have experiences where it can be a little bit more involved in terms of the removal, but we do have lots of techniques and tricks for that as well.
All right, this is going to be our last question, and it comes from Ida Friedman. How does the hormonal IUD help with endometriosis? Does it really help or treat it?
That's a great question. Gets into a whole nother kettle of fish.
Whole nother nugget.
Progesterone-based medications are actually now first-line treatment for endometriosis, and the intrauterine systems with progesterone on them are great treatments for endometriosis. They're providing progesterone locally at the level of the uterus, a little bit elsewhere in the pelvis, and that helps to slow down the growth of this condition, which we have a lot of time to get into, but for those who are familiar with it, it does slow down the growth and progression of endometriosis and is absolutely recommended very high up there on the treatment options, because people are going more lately towards progesterone-based treatments for endometriosis, of which this is one option.
Mm-hmm. Thank you all for your questions. I just wanted to wrap by saying one of the things that stood out for me in the Canadian Paediatric Society report was also that parents need to talk to their kids
Absolutely.
about having sex and the risks, and in small doses even, just to get them to ask questions. Because, you know, when you get to the doctor's office, I'm sure you see a lot of teens who are scared and aren't sure what they're getting into. So it is important to have that conversation with them. Thank you for all your questions. Thank you, Dr. Spitzer, for taking. Yes, you can.
That's a great point. People should be talking in families and with their friends about contraception and contraception options. But just like medication, we have no age of consent in Canada. If somebody can understand and have the capacity, they can have this done, and they don't require anybody's consent to have an IUD placed or to have a prescription for any medication or birth control.
I think that's a fantastic point, because one of the, we had gone to Planned Parenthood Toronto, and we had listened to some of the phone calls that the teenagers there were taking, and one of the biggest questions, although we didn't get it probably because our audience here is a little bit older, is, can I get an IUD without my parents knowing? And the answer is yes.
It is.
But you have to show that you understand the risks and that you are capable of managing. And I think that goes back to the conversation that, you know, and I say this just as an aside, but what's a good conversation starter for parents who have no idea how to break the ice and talk to their kids about sex?
That's a great question. You know, I mean, I would say some of the tricks that I use with patients just to get in a bit of a conversation. You know, what's happening at school? Are people dating? What's happening in your grade? You know, any boys or girls who you have an interest in, or things like that, you know, or just sort of maybe even ask about other people or what's happening in their crowd, and what do they understand about what's happening and what their own thoughts are, what are their perceptions. You know, sometimes starting with what are your perceptions of what's going on around you, and then bring it back to yourself. Okay, so those people are doing that. What are you thinking about? What are you doing? You know, and stuff like that, or what do you understand? And I think the small doses part is important. Sort of open and inclusive conversations about sexuality, sexual identity, contraception, behaviors, etc.
Yeah, feel icky, but it's doable. So thank you all for your questions, and we'll see you guys next time. Thank you.
Thanks.
Some great questions.